Welcome back to the Brass Tacks Business Podcast, everybody. My name is Dr. Keith Brassfield. Thank you all so much for joining in. Today, we've got a local guest here on the show, Dr. Grant Westbrook. Dr. Grant, thank you so much for coming on.
Absolutely.
So Dr. Grant is definitely someone who really understands what it means to be an athlete, dealing with injuries, and more importantly, how to come back from them even stronger. Dr. Grant is local here, originally from Leesburg, Virginia. He grew up as a multi-sport athlete, but football was always his main focus. He went on to play at James Madison University, and during that time, like a lot of athletes, Dr. Grant dealt with his fair share of injuries. Instead of letting that sideline him long term, it actually pushed him toward his career path. He earned his degree in kinesiology from JMU, then went on to get his doctorate from physical therapy from Radford University. Dr. Grant works with everyone from youth athletes to weekend warriors, and what really stands out is his approach. He's not just focused on getting people out of pain, but helping them build confidence and tools to perform better long after they're done with rehab. So again, Dr. Grant, thank you so much for coming on. It's glad to have a Leesburg local here on the podcast. Tell us a little bit about yourself. Obviously, you grew up here in Leesburg. How'd you get into PT? Kind of a little bit about your story and where you're at now.
Yeah, I grew up in Leesburg, been here my whole life. I grew up extremely active, played all the sports growing up. There really wasn't a time frame where I wasn't on a team doing a sport and inherently maybe over time managing some injuries. That was my sole focus growing up, and naturally over that course of time I had my fair share of physical therapy exposure, and I had a lot of exposure to different clinics that are in this region. I got to go to a lot of different providers, and that really sparked my interest in the profession. I have always loved athletics, sports, performance, and the human body, and then being able to apply that to a career path was always really meaningful for myself. And as a frustrated athlete wanting to be on a field and not being able to, it provided me an awesome pathway to be able to help individuals, be able to take someone through a frustrating course of time that I was experiencing, and allow them to navigate those waters and get back to the things they want to be doing without those pain limitations. That really had a negative toll on me for a while there growing up. So very blessed to be able to do it in the area I grew up in and have familiarity with, and kind of give back to the community that I've been involved with for a very long time here.
You're awesome. And so, Grant, I know you played multiple different sports. How did you finally focus on football? Like, why was that your main focus? Did you just enjoy it the most, or was there anything about football that you enjoyed more than other sports?
Yeah, I had played every sport, baseball, lacrosse, track, you name it, I'd played it. And then at some point throughout high school, probably freshman, sophomore year, I decided this is my thing. I like this the most, and I like the team sport element of it. It's the ultimate team sport. I enjoy that the most, the camaraderie. And at some point, I just put all my eggs into that basket. That was what I wanted to do. I wanted to play in college, and that was what initially sparked my interest to be as active in the weight room and training as I was, and naturally dealing with injuries in a contact sport. So that's where some of the eventual frustration grew, where you just can't get healthy, you can't stay on the field, and you're looking for individuals in the community that can help understand where you're coming from and help you get back. And over the course of time, you found those individuals, and they had such a meaningful impact on me growing up to be able to feel like I was myself and do the things I wanted to do. So naturally, as I went off to college and started playing, I got exposure to athletic training, and I got exposure to college rehab. I got to see the differences, the disparity between maybe what it's like in the outpatient setting in a community essence, and then going to a college and seeing what it's like when they're applying it to high level athletics. And then fast forward, getting to the current position I'm in, feeling like we can be a company that kind of operates more like a college environment, give people that exposure of like, yeah, we have technology, we have things that are more accessible to these individuals who want to be higher performers. And how do we take that same approach and try to apply it to the general population of individuals who are weekend warriors who want to be active but have pain points, and oftentimes they can get over medicalized and they become these large ordeals, and oftentimes it is more simple than we make it out to be, and it really comes down to knowing the individual, the demands of what they have to do, and how to navigate those waters to get them back to the activity they want to do. So that was a long-winded way of saying that, yeah, all my experience growing up, getting injured, and having individuals that were positive in my life really led me to want to be that individual for someone else.
So playing football at JMU for 4 years, I also know that you got your strength and conditioning certification as well.
Mm-hmm.
What were some of the differences you noticed while at JMU that, or at the collegiate level in the rehab setting? What were some of the differences you noticed, that maybe you didn't get in high school or prior to that?
I think individualization is maybe a thought that comes into play, more nuanced assessments, more ability to spend time with individuals and apply a plan that makes the most sense for them in totality, all of the different things they maybe have going on, and then access to just different pieces of equipment, objectivity in a rehab context that allows the process to be done at a higher level, I would like to say. So, those are one of the larger disparities I would find, just access to resources, the types of expertise these individuals had of seeing these conditions all the time. I think we underappreciate how important it is that you and the person you're being treated by can speak the same language. They understand where you're coming from. They understand what your terminal goals are, and they understand what the demands of that are, so they can best prepare you for that. Because I think that's where sometimes we can fall short of not understanding kind of what they need to get back to and what the demands of that are, so we can adequately prepare them for that.
Were there any big injuries you had, Dr. Grant, in college that kind of just played a big role in your journey or maybe changed your perspective to where you're like, you know what, this is, or did you know you were going to do physical therapy the whole way?
It was always in the back of my head. But then at some point, I had a meniscus surgery, a knee surgery in college. Had a little bit of loss of time for that. End of my college career, I had a labrum surgery on my shoulder. So those longer stint rehabs, I definitely got more intimately involved with athletic training room and strength and conditioning. Those certainly sparked my interest and made it more solidified. I had an inkling I wanted to be in performance and something like that, but I like helping people, athletes, moms, weekend warriors, regardless of it. So it was awesome to be able to apply those things I had an interest in already, performance, and apply it to something that was longevity wise, a career I enjoyed, not at a desk, on your feet, helping people get to certain goals they have. It just really fit a lot of boxes for me. So it was a natural fit at that point onward.
Okay. And now that you're here in Leesburg at Rehab to perform, obviously seeing some of the same stuff come into your office for meniscus tears, you mentioned labral tears. With the clients that you see, you mentioned weekend warriors, those elite athletes. What do you feel like is the biggest thing you hear? Because I know I've referred to some PT offices and I've heard good feedback. Obviously I know you guys do a phenomenal job. What do you think it is that sets your office apart from maybe a typical, PT office that a patient will go to?
I think there's a couple big variables I think make a big difference, and you're getting quality care versus maybe otherwise. I think the one-on-one care with a doctor of physical therapy is very important, and working with an individual who has expertise in this is always valuable, as opposed to maybe other facilities that employ techs, aides, etc. that you work with predominantly. But then it's the ecosystem that we create. It's our culture. We're a fitness forward healthcare company. We're trying to integrate fitness into healthcare. It shouldn't be a reactive healthcare system. What can we do to be proactive? How do we make people healthier? How do we promote movement as exercise? How do we allow to take away barriers of people who have limitations where they can't move, but they allow those limitations to turn into a complete stop of their physical activity. And that's so damaging, not only to their mindset, but their long-term health. I think the types of clinicians you have, their ability to modify things, understand the terminal thing that brought you in the door and what we can do to modify around that right now, A, to make you feel better, but B, to get you more active more quickly. And I think we underappreciate the value in maintaining a physical activity baseline longer term, and those loss of time injuries that we've all experienced are very negative, especially in the healthcare system that prior to direct access, where you had to go to a doctor and you had to get a referral and you had to go see them 3 weeks after to schedule that appointment. And that's 4 weeks, 6 weeks, you haven't done anything. So the nature of being able to see people more quickly, give them information, empower them to keep moving and work around their condition and find ways to move the needle forward day to day has been extremely valuable, I think, in the long-term aspect of people. And then ideally, in our setting, this is not a one-stop thing. You come in for your hip. You shouldn't have to see me for your hip again with everything I've given you in the empowerment of education and exercises. But second to that, we want to promote long-term movement health. One of our totems is like perform for life. What can we do now to allow you to move better, not only in the current context of what you're doing, but 5 years from now, 10 years from now? How do you stack habits? How do you stack skills that you can carry forward despite the injury you're managing?
What do you feel like is the biggest mistake people make? If they come, like you mentioned, sometimes they have to wait 3 or 4 weeks. What is the biggest thing you see, or people get injured and they may come see you or go to another provider? What do you feel like the biggest mistake people make is when they are getting injured? And
I think some of the shortcomings I see if someone does come to our office injured and it's been a time loss injury is just the detraining effect that can happen, especially those that are highly active, they're in season athletes, and those time loss injuries are very damaging when you're in season. And their inability to maintain the physical qualities they worked really hard to get in the preseason is always really, really damaging. So maintaining people's physical qualities or those baseline levels of function is always a big goal of ours while we're still managing some sort of acute injury scenario. And then based on the longevity of it, obviously goals might change. But if it's something more short term, yeah, absolutely. We need to find ways to keep moving. We need to find ways to continue being active and moving the needle forward despite there being a limitation that exists right now. But education, I think education is going to be a thought that something I bring up often. If you can empower someone with helping them understand what they have going on, you just gave them the tools to better manage it themselves. I think we fall short often in this profession of maybe not having time with individuals in the healthcare system, not having time with individuals to tell them about why this is going on, how do they manage it. And once you provide that information, those tools to them, it starts to make more sense. And then you're allowing someone when they're outside your four walls to continue moving that needle forward as opposed to being reliant on yourself. So very empowering to be able to give those tools to someone so that they feel like regardless of this comes up in the future, they have a clear pathway to get out of that again.
what's the most rewarding part for you, Grant? You've seen a lot of different patients from a lot of different genres. What do you feel like kind of keeps you coming back, keeps you eager to learn more? I just keep getting better.
Wanting to do best by the people I'm treating. And that could be anybody. It could be the mom who wants to walk up the stairs with their little baby because it's bothersome to do that. It can be the 1 year rehab following an ACL injury and they just got back to playing high school sports and they had a phenomenal senior season that they thought they were going to miss out on. So it's the people. The people are by far the reason you do it. Those are the reason you extend yourself and stay after work. It's because of the people that you inherently care for and they trust you and you want to know that you're doing your best to provide them with the best service or care you can possibly provide them.
What's the most common thing you hear from other PT offices? And this isn't to talk poorly about other PT, but I've referred so many people who they work with a therapist for doing whatever type of modality, and then they're kind of over in a corner doing stretches either by themselves or with a sheet of paper.
Mhm.
Why do you feel like that's so common that we hear that? And, kind of how do you guys combat that?
It's a very common thing, and the physical therapy profession especially. It's the amount of individuals you need to see to break even. It's a part of people's business models. They just are double booking individuals. They employ extensions of their staff that maybe aren't as skilled in certain areas to treat certain conditions. Not to say they don't provide a lot of value. It's just not their forte. So from a company standpoint, I think it's very important for us that we provide one-on-one care. And you're only going to see the doctor of physical therapy, and everything's going to be very individualized. It is common, like you had mentioned. You get a sheet, you have shoulder pain, here's shoulder exercises, here they are. And that was a shortcoming I found. I was a 16, 17-year-old athlete who I felt like I was pretty athletic, and I found myself doing the same thing that other individuals were doing with bands in the corner. I just had a more resistance band. So it's not nuanced, it's not individualized. That's a large shortcoming, and I think it comes down to a systemic issue we have where insurance models force you to treat so much volume in order to break even that it can detract from the overall quality of care you're getting. So it's a very large point of emphasis for us to say we're going to provide one-on-one nuanced individualized care, and we're going to do so within the confines of insurance to make it more accessible to people. You have to find that fine line between the two things as it relates to business, but I think that's the number one thing that attracts me to the company, the type of people we have and the rationale that we have and the importance we put behind individual care, because that is the number one thing that people are going to respond best to and feel like they're getting the best care, as opposed to what you had referenced, the sheets of paper that are very very surface level and really don't seek to dive deeper for an individual. What can we do to dive deep with someone, learn a lot about them, what they want to get back to, not just stay surface level and assume things will get better.
Grant, I think you posted somewhere, maybe it's on your guys' website, I can't remember, but I feel like your approach lays heavily on activity, movement, gaining strength rather than just mobility and range of motion. Can you kind of break down that philosophy for us and tell us a little bit more about that?
Yeah, absolutely. That's not to say that, mobility and other instances of that aren't important, but I do find that to be a shortcoming of the profession. The medical spa The massage, the heat, all the modalities, they certainly serve their purpose, but we need to understand where they don't serve a purpose. And as we have individuals go to further in their plan of care, strength, stability, power, they're going to be limiting factors as it relates to actual terminal goals and function. And I kind of relate that to the thought of rehab versus performance. And our company tries to bridge that gap. What can we do to bridge the gap between rehab and then getting someone back to full function of the activity they want to be doing? And oftentimes that is going to equate down to you have a large strength asymmetry on this leg versus this leg. You cannot do said this terminal task on this leg as well as this one, and that's going to show up when you put yourself in a position where time demands are high, you're reacting to another individual. So the better you can understand what the terminal thing they're getting back to doing is, you can start to appraise and understand, yeah, power, strength, these are important qualities. And unfortunately, it's maybe not everyone's forte, and the equipment they have in their facilities may not allow them to do that well, but we put a lot of onus in that. And when you walk into our facility, there's barbells, there's squat racks, there's sleds, there's turf, there's a lot of room to move. And I think that's important. If you're going to get someone back to an activity that demands that you're strong and you move well, you should be doing that in physical therapy. We should be allowing you to do that in our facility with medical supervision, and then allow you to then take that confidence you built and apply it to your outside life, outside of here. So getting people strong is by far one of the more rewarding things, especially those who maybe haven't considered that in the long term for keeping themselves healthy. And I think that's where a lot of our profession can fall short. Trying to find pain relief tools is excellent, and I want to do that. But longer term, I want you to be a more robust, resilient individual. And I think that often does come down to strength and the type of foundational fitness level you've developed. And if we can build habits in physical therapy that you can keep up with, even better. Let me refer you to a personal trainer who can keep this going, or let me give you a routine you can keep going with here. You're trying to play the long game in these instances, and trying to make that make sense to the individual about why that's important is huge.
I agree 100%. I'm very jealous of how much space you guys have, but you're exactly right. It's totally set up to do those sports specific type exercises because you guys have the turf and you guys have the tools. And the square footage alone is just like awesome. You can actually recreate on field type activities, which, I think is amazing.
It's excellent. And I'm younger right now. I can keep up with my little athletes running around. There'll be a day where I can't keep up as well, but I'll keep it going for as long as I can.
Nice, nice. So tell us, earlier we were talking about some of the assessments and the different technology and tools you guys use with your clients at Rehab to Perform. Tell us a little bit more about that, how you guys can do different assessments and diagnoses.
A lot of our assessment tools will span across the lifespan, because we're going to treat 8 to 88 is what we like to market. So we have a large, breadth of who we treat there. So there's going to be different tools for different individuals, but as it relates to the certain population of like higher level performance individuals, people who we need to assess to get back to really demanding tasks, that does necessitate tools to assess that. Otherwise, you're guessing, and guessing is a very inappropriate thing to do when you're rehabbing someone post-surgically or something of that nature. Some of the things we employ often in our facility, I think you do this one as well. Dry needling is a very common one to modulate pain and improve range. We'll use blood flow restriction very commonly in our facility. Excellent way to facilitate strength gains in the context of being in pain or post-surgically. So an excellent way to continue someone's rehab process early on. And then from an assessment tool standpoint, we employ a lot of isometric testing, or dynamometry they'll call it, or gone are the days of push into my hand, that felt strong, do it the other side, pretty strong. Now we have objective data, and that's where the profession's moving. It's 2026. That's going to become more of a theme. We're going to get numbers. We're going to get, you have 100 pounds of force with this leg versus 60. This is glaring. We need to fix this. So that's a large tool we have from a force standpoint. How strong are we? Because we care about that. And then one of the more relevant pieces of technology that I use a lot in the facility and help our company use are force plates. Fancy scales you stand on and jump on, and they measure force 1,000 times a second. And it can give us very nuanced information about when someone's moving really fast and my eyes can't see it, are we shifting off a leg? And that's more the gold standard as you look at higher level athletics, NFL, things of that nature. So from our company perspective, if we're going to treat these individuals and we're going to market to college athletes, professional athletes, individuals who want to be athletic, and have that lifestyle, we should have the assessment tools to be able to tell them this is where you're lacking, this is what we need to address right now, and I want to provide you a very clear pathway to get to that point with objectivity. It takes a lot of onus away from me of being that mean guy of just, I'm not letting you go back to play. Hey, listen, the numbers said what the numbers said. So if we can make it more of an objective conversation and then we can pair that with some decision making that we can talk about together, that's much better than having individuals who unfortunately go back to play just purely off a timeline or go back to play simply because they feel like they're ready enough. And I think that's as it relates to return to activity, return to sport. Unfortunately, I feel like that's a thing we don't do well in our profession. So it's something we put a lot of onus into and very much are trying to push the needle forward for in our profession and be different than other people around us. And that should be evident when you walk into our facility and see the things we have accessible. We want to be different, so we're going to operate differently and have things that maybe not everyone else does for that rationale.
Return to sport is so difficult being an athlete myself because I, you know, I know that when I was in high school and college, they told me not to go, and I did it anyway. So it's so hard being on both sides of the of the table on that when patients are like, can I go play golf yet? But anyway, back to the force plates. I did not know you guys had force plates, which is awesome. Can you, other than just a straight up, like squat jump, can you guys use that for sports specific, like hockey, like golf, like tennis, and use the force plates in that way as well?
There are more nuanced ways that you can apply it in that fashion.
Okay.
I know you're a golfer yourself. There's
Yeah.
instances where you can see if people are shifting during their backswing. You can see how much if they're unwilling to load that front leg in their swing, and you're not leaning into that leg. There's certainly more nuanced things we can do in that regard, and we have assessment packages that we provide for runners that are a little bit more in tune with that. A large aspect of what we're using that for our rehab context is as someone has mobility gained. Great, check that box. We're moving up grade. At some point, we're going to get to the point where strength is our goal. We've accommodated that. We tested that. Excellent. Now we get to a point where power, reactive strength, fast motions are becoming more of the theme. That's very challenging to assess meaningfully. So force plates provide us information that we otherwise don't have the ability to garner. So how much time are you spending on the ground? How much force are you applying into it? Which leg is doing more work? Are you shifting off of a leg during the down portion of a jump? Or are you shifting maybe away from it on the up portion? That might dictate I give you different exercises within our facility to work on. So it just layers on your ability to assess things in a very meaningful way, but in an area that otherwise, where technology, if it wasn't existent, would be very challenging. So that's where we employ it most, just to look at different physical qualities we know are important. We have a hockey player and we know they have a left leg injury. Let's screen that. Are we using the left leg the same as our right? When we're double leg, are we shifting off of it? In single leg, apples to apples, does this left leg go higher or less high than the right leg? That information can be employed to then say, all right, it makes sense why this backswing, it makes sense why this movement isn't going very well. Because at the end of the day, you need to have the physical tools in order to do the thing you want to be doing. And if we can identify there's strength loss, there's power loss, they're going to show up in the terminal tasks that we have on the field as you try to express those qualities out there. So it's just a great way for us to be able to say, this is the deck of cards you're dealing with right now. We need to address these variables in order for that task to go well.
That's super interesting. So are the force plates purely diagnostic just to get objective data, or can you use the force plates treatment as well?
Yeah, absolutely. Something I use in treatment very often. Post-surgical, excellent. Think of a lower body rehab, knee replacement even. Older individuals are a meniscus injury, like I had mentioned previously. We'll use that for biofeedback. I'm going to give you live data that's going to show you during each rep, are you using those legs similarly? I'll do it screening. Oh, you're 30% asymmetrical. You're shifting a lot away. Let's do our exercise today on this. We're going to squat. Take that bar, move up and down, and each rep, I want you to be mindful of that symmetry number. Keep weight on that side. That's a really valuable tool because then you can start to ingrain to that individual. This is what it feels like when you're symmetrical. And then they can start to take that. I don't find myself in there every day, but I find myself in there occasionally. And then that translates out to our gym space very well. So there are certainly a lot of more nuanced things you can do to apply it into the treatment itself, or I can use it for speed. I can say, I need you to be moving a certain speed during this activity because we're working on power and speed right now, and this is going to give you a number for that. So you can certainly leverage that information to get the patient to buy in, for the patient to have a goal, for them to understand maybe why they're not going back to play. Yeah, this is 30%. That seems like a lot, right? So it can help it make sense to them. It can help it programming exercise to be extended however you can find ways to use it diagnostically or to try to reinforce certain qualities that you're finding are important.
What are a few simple things that you recommend for your clients? Say they're not an elite athlete. Say it's just an everyday kind of active adult, and they want to take better care of their body. They want to maybe they're not injured, but they want to prevent any further injuries. What are some kind of helpful tips you give them?
I find the individual, like, invest in your health, invest in your body. I know it's people get busy. I myself am not as active as I want to be, but I think it's finding value. It's finding value in your health. It's finding value in things that activities you want to be doing. People can talk badly about pickleball all they would like to and the injuries that come from it, but the amount of individuals who are older, who are getting active, who are coming into our facility and saying, I have knee pain and I'd like it to go away so I can continue playing pickleball, and I'm going to pick up an exercise routine to support me playing that, is excellent. So I think it's just finding activities that you find meaningful, things that you know are going to improve your health span is the biggest thing. I view health as independence, especially as it relates to the lifespan and getting older. What can you do now that's going to reinforce, a positive independence later on, where you can do all the things you want to do without limitation? And I find that limitation is a very common thing that people self-impose on themselves or have been imposed onto them by somebody else, maybe saying, "Not ever do this anymore." What can we do to break down those barriers? If we're stopping an activity at 50, what's that going to look like at 80? And how do we reinforce that? What your body's doing now is what it's going to get used to doing. And if we can stack good habits, if you're used to doing 15,000 steps a day, it's not going to be that challenging when you ask yourself to do 20 and you're on vacation and you want to hike. But if you're only used to doing 5 and you want to have that independence to keep up with family, it's going to be harder. So you got to find value in it. I think that's the biggest thing. And I'm trying to find ways to find what these people, my patients, want to be doing, so I can help correlate. This does support this, and this will help your longevity.
Awesome. All right, Grant, last question. So if people are looking to get in touch with you at Rehab to perform, how do they go about doing so? Or what's the best way to kind of get in touch with your office?
Our website's phenomenal. Online booking is certainly a thing that people can employ. I would certainly welcome people to call us in our office locally, or they can reach out to myself. My contact information is online as well, or Dr. Westbrook at rehabtoperform.com is my email. Fitness focused rehab, trying to bridge that gap between rehab and performance, work with all the lifespan, and I very much enjoy helping to take people back to the activities they want to do and help empower them. Despite all the talking I've done about how active our facility is, we see the lifespan, and I enjoy seeing a lot of my, everyday just working moms and dads. I enjoy seeing our youth individuals who maybe aren't as athletic or sport driven, but have pain. And it's certainly appropriate for everybody. And I certainly think that the product we provide is competitive with everyone out there, and would very much enjoy getting to work with anyone in the area that would like to come over here. We're in the DMV across the whole area.
I definitely recommend Rehab to Perform. I've gotten great feedback from the patients that I've sent over. What do you feel like, Grant, is coming up in the next 10 years in your industry and in physical therapy? What are some things you see kind of on the horizon, on the future? Where do you think the profession's going with, all the technology, all the assessments and tools you guys have now in 2026? Where do you see that going in the next decade or so?
I think in the last 5 years, you've seen a large uptick in the technology. Some of the things I mentioned, the assessment tools. So I only imagine those are going to grow. Our ability to identify issues is only going to grow. There's a large influx of AI in every profession. However, I don't imagine that's something that's going to detract from our profession greatly. It's a person-to-person industry. It's a service-based industry. People want to feel connected with the individual they're treating. So despite having a lot of technology influence within our profession, I don't imagine that's going to fully take over into you can manage conditions independently with just AI and and things of that nature. I very much view the profession as leaning more into technology, and in my ideal world, our healthcare system and the kind of totems we have of trying to be more fitness focused healthcare, trying to be more proactive about our health as opposed to reactive, is highly, highly important. I'm hoping the profession moves in that direction. I use the reference of a doctor, or a dentist's office, and the wellness checks you have 6 months, go and check things out. We're going to employ movement screens or health screens every year, just like you see a medical doctor or a dentist. What can you do to come and see an individual like myself to let you know about certain areas you might benefit from managing just to stay healthy, even though you're not feeling like you're in pain? Instead of reacting to pain that happens, what can we do to be proactive? I'm very much hoping that our industry becomes more fitness focused, promotes health as a means to prevent injury, and ideally becomes less reactive in that regard. So I hope the assessments get more meaningful. We can determine what's going on more quickly. But more than that, I'm hoping to see less and less individuals in these scenarios where they're only reactive to things, and there is a little bit more of a push in our whole healthcare industry to try to be a little bit more fitness forward, or trying to promote movement as medicine would be a big thought for me.
I couldn't agree more, Grant. The dentists have done such a phenomenal job at making sure we come in every 6 months for our cleanings, but somehow us physical therapists and chiropractors just can't have a wellness patient come in just for wellness. So
Yeah,
hopefully the industry, changes. But I've seen a big shift since COVID. I've seen a lot more people coming into my office saying, "Hey, I don't have any problems. I don't have any injuries. I'm just looking for wellness." And I'm like, "Oh, that's like a breath of fresh air."
absolutely.
So I agree with you, Grant. Well, thanks so much for being on. Anybody who's listening, all of our listeners, I couldn't recommend Rehab to Perform any more. So please check them out. They're right over in the shopping center off Catoctin, next to next to Play the Par Simulator, which I'm always at. Next time I'm over there, Grant, I'll try to stop in. You guys also have offices in Reston and Tyson's as well.
Yep, Reston, Tyson's, and Springfield. We're also through Frederick County, Montgomery County, in the Maryland region as well, breaking into Baltimore too. But all internal growth, all individuals in our company who just we're expanding, and yeah, excited to try to treat more individuals in the DMV, and absolutely we'll take you up on the offer to go to Play the Par.
Play the Par
It's
for
very
sure.
fun over there.
Awesome. All right, guys. Well, thanks so much for tuning in. Dr. Grant, thanks for your time. And check out Rehab to Perform, guys. And we'll see you on the next episode.